Today we are quickly going to talk about the diagnostic approach to dizziness. So the first step when a person comes to you in the clinic that they have dizziness is to ask them that what type of dizziness they have. There are four types of dizziness. The first one is disequilibrium. The patient is going to tell you that they experience imbalance when they are walking specifically, and they might fall on their right or left side. The second type is presyncope. Presyncope means that they're about to have syncope, they're about to faint. The third type is vertigo. Vertigo means that when they change the position, suddenly they'll have spinning of the room. And fourth one is lightheadedness. The second step is that why is it important to know these types is because each type correlates to a specific etiology. For example, disequilibrium means that there is a pathology in the central nervous system, and presyncope means that there might be a pathology in a cardiovascular system. What could be the causes of central nervous system pathology, such as stroke, multiple sclerosis, Parkinson's? Presyncope could be due to MI, arrhythmias, and even some medications. Vertigo usually means that there is some problem in the vestibular system, that is our ear. The causes would be any inner ear infection, Meniere's disease, benign positional vertigo, or vestibular neuritis. And lightheadedness means some general causes, such as anemia, thyroid disorders, anxiety, medications. The next step is that we have to take a detailed history to rule out all these possible differentials that we just talked about. So first of all, neurological features like abnormal gait, visual disturbance, hemiparesis, numbness, speech problems. For cardiac features, you can ask about chest pain, palpitations, sweating. For the vestibular features, any recent ear infection, do they have tinnitus, hearing loss, any feeling of pressure or fullness in the ear? And finally, you have to ask about the medication history, symptoms of anemia, thyroid dysfunction, and anxiety. So even if you are sure about the diagnosis and the history is straightforward, please do not forget to ask about the red flags. Red flags are basically either neurological deficits such as dysarthria, diplopia, dysphagia, hemiparesis, any altered mental status. These are all indicating towards a stroke most likely. And then cardiovascular symptoms such as chest pain, dyspnea, syncope, because they could have MI or any kind of arrhythmia, which is definitely an emergency situation. So the next step is to look for the vital signs. In the vital signs, we look for blood pressure. For example, if the patient is hypotensive or if they have orthostatic hypotension, that is a difference between lying and standing blood pressure of more than 20 millimeters of mercury. If the patient has hypoglycemia or they are going through a certain infection and they have fever, if their oxygen saturation is dropping to less than 94%, or if they're tachycardic or bradycardic, then all these vital signs will also give you a clue to the cause of dizziness. And remember that if the vital signs are unstable, in that case, these are also red flags and the patient needs urgent medical care. So after you have established a probable diagnosis, you have to physically examine the patient. For example, if you think that it is a central nervous system pathology, do a full upper and lower limb neurological examination along with the cranial nerves. If you think it is cardiac, do a cardiovascular examination. For the vestibular system, do an ear examination. And if you feel it is generalized lightheadedness, it is something vague, then you have to look for signs of anemia, do a thyroid gland examination as well. To learn about these examinations, you can refer to Geeky Medics. So then you have to investigate the patient. So for example, if you're thinking that it is stroke, you have to do a CT scan brain. If you think that it is MI or any kind of arrhythmia, then you have to do an ECG or refer them for echocardiography, 24-hour Holter ECG. If you think it is vestibular, then you have to do an otoscope examination. If they require any hearing test, you have to do hearing tests. If you're thinking that it is benign positional vertigo, then you have to do Dexel-Pike maneuver. And if you think it is anemia or a thyroid disorder, then you have to go for CBC, ferritin, vitamin B12 levels, folic acid, thyroid function tests, and a full basic profile in some cases where symptoms are vague and you're unable to reach a diagnosis. So finally, you have to manage the patient according to the cause. For example, if it is an emergency, such as any neurological or cardiovascular pathology, stabilize the patient and refer them to ER for further management. And if it is not an emergency, any other cause, then you would follow them up after the test results and manage according to the cause. So basically that's it. I tried my best to cover this very vast topic into a very brief discussion because it is pretty common to see dizziness in our clinics. So I hope this video will help you organize your thoughts on how to approach a patient who comes with this complaint. So if you like the video, do give it a thumbs up and subscribe to my channel and share it with your friends as well. Take care. Bye bye.